So I'm not taking initiation, just I want to discuss, share some problems we are facing daily. So because of the hot summer, there is scarcity of blood in the, not in our hospital as well as in the city. So we are facing problems like daily used to get donors at 4 o'clock, 4:30 or in the morning when the patient is in OT. So we are facing problems because we cannot take donate blood so fast so that it can be delivered to the patient on the OT. So if we take some policies and we can implement in the central hospital, not only the surgeons, the others will be also benefited. And blood bank, we know the blood bank is meant for to supply the safe blood. So I have discussed before also the same topic and same headline that partially Dr. Jishidas used to follow this, and I know he has benefited from it, and his blood we used to share with other ward also. We used to issue his blood to other ward. So what I have discussed, like those who are coming on for surgery under planned surgery, not emergency, those who are planning the surgery long time ago, so we can tell the patient to donate blood advance, at least 15 days back, and make it mandatory to all patients who are undergoing elective planned surgery. Suppose for the coronary you are not requiring that blood, so we can keep that blood under your head, like it is meant for surgical, female surgical, or male surgical, or orthopedics like that, and you can use that blood for your own patient. So we can maintain that register, okay, this blood is for this unit. And if you are not, whenever there is excess or nearby expiry, we used to call that word, whether you are going to use that blood. So when they say, we don't require, then we used to issue the blood to the medical wards. So if we follow this in-house policy, I think we will be benefited. All of us will be benefited. And for our problem is, we can give you the blood at whatever time you ask. But 4:30 or 4 o'clock is not the time, because one donation of the blood, as early as it takes 2 hours. And I said the blood bank is for the supply of safe blood. So safe blood means if we test by ELISA, then only we can we cannot we can say it is safe. And if we collect blood on emergency basis, we cannot do incremental ELISA. We have to give by spot test. And all of us will know, wherever the company says these are more sensitive kits, but in practically we have seen this is not that sensitive, but ELISA is much better than this spot test. So I request all of the surgeons particularly, if they follow this guideline, like whenever they are going for the planned surgery, will avoid the patient, they will say the patient, okay, you arrange your blood beforehand, whether it is required or not required. And I think by compulsion also, then the patient will come and with the donors. This is one part. And second part, nowadays people are preferring this autologous donation. I think next my presentation I will take on this autologous donation. If the clinician feels the patient is fit for autologous donation, fit for donation like other donors. So if that patient can undergo autologous donation and that blood can be used for them. So here one drawback is there. The doctor has to be sure that blood will be used to that patient only. Otherwise the blood has to be discarded. So if the surgeon is sure during operation I need blood and the patient will be confused, they will go for autologous donation. I think that will be the safest blood for that patient. Thank you.